Cellulitis. Introduction. Please point to the epidermis. Choose one of the following options. Correct. This is the outer layer of the skin called the epidermis. John has a fever and chills. He cut his arm when doing yard work and the area around the cut is red and swollen. Should John contact his healthcare provider? Select yes or no. Correct. Fever and chills, as well as red and swollen skin, can be a sign of a problem. John should contact his healthcare provider right away. Cellulitis is most often caused by group A strep bacteria. Select true or false. Correct. The bacteria enter your body when you get an injury, such as a bruise, burn, surgical cut, or wound. Sarah has cellulitis and has been given antibiotics. She starts to feel better a few days after taking the medicine, but still has some pills left to take. Should Sarah stop taking her antibiotics early since she is feeling better? Select yes or no. Correct. Always take antibiotics as prescribed by your healthcare provider. Even if you start to feel better, finish all of the medicine given to you. Can cellulitis and other types of infections always be prevented? Select yes or no. Correct. You can take steps to reduce your chances of getting an infection. This does not mean you cannot get an infection. Thank you for using Explain.